Kia ora tātou, talofa lava, kia rana, nisa bulavanaka, whakalofa lahi atu. And hello. I've got a sore face from smiling at people that I have worked with since I was a very young person. And that brings some comfort, actually. I'd like to acknowledge the leaders in our room and the tremendous amount of work that the NGO sector does, often unrecognised, often undervalued, and often unappreciated. And so I really think that this meeting today is important. Pasifika Futures is the Pacific Commissioning Agency under Whānau, or it's a new program, and I can collectively hear people groan and say, here we go. It's a new business card, it's a new office, it's a new group of people we have to deal with. So for our sins, yes, that's us. And I'm very pleased to be here with my colleague Helen Leahy. So at least there's two of us and we don't feel so alone. So clearly our purpose is to work with Pacific families from Invercargill to Kaitaia, and yes, it is a surprise, there are Pacific families in Kaitaia. There might only be 3, but we know who they are. And to make things better, to work with families to really support them to deliver on their aspirations and their dreams. When my father came to New Zealand from Tonga, he had the same dream I have and the same dream many of you have. He came here as an immigrant, albeit forcibly, out of the Pacific. It wasn't a voluntary thing when they moved our families out of Tonga. It was post-war. And he came here wanting a better life for his children, for his brothers and sisters, for his parents. And those indeed are the dreams that we all have, and the dreams that I certainly have for my family. And so really it's kind of apple pie, motherhood, you know, all the good, fuzzy, warm things, but unfortunately coming here to New Zealand isn't such a great deal. So we started off with thinking about what it was that our families wanted, and to do that we started to talk to people. And so we talked to 1,800 Pacific families, because we had a lot of government agencies, a lot of incredibly learned advisors telling us what they thought families needed, what they thought people needed to do, how other people could fix their lives. But in fact, we thought it would be best to actually just talk to our people. So we did that, and for my sins, we started off in Invercargill, and I still don't understand why our people live down there. It's very cold, and there isn't a palm tree in sight. So we developed a strategy really that looked at what were the results, and the results are, you know, there's no surprise here. There's nothing new. It's the work that you're involved in various guises every day. The question is in the best way that that can be achieved, and the commissioning agencies really are a new model. So we had a strategy that focused on the results and what our families were telling us that they wanted. We thought a bit about how we could achieve that and what sort of organisation we needed to do that, and of course what little bit of dosh the Crown would give us to actually make a start. The really interesting thing for us was that in talking with government agencies, the intellectual capacity and capability around Pacific outcomes has dropped in the Crown. I was a chief advisor many years ago, working in health, working in the Pacific space. And when we went to agencies, not much has moved on. And if anything, the capacity in the Crown to understand Pacific families and their needs and their aspirations, I think, has dropped somewhat. There hasn't been a great investment in the Pacific sector, be it NGO or Crown resources. And so really things have been a bit static. So this has provided a fabulous opportunity for us. When we talked to families, there was no surprise. They wanted their children well educated with a better future than they have. They wanted them to have jobs and be able to look after their children and their families. They wanted to live long enough to see their grandchildren and to live long enough to enjoy their families. Not one person said, I want to improve my diabetes. Isn't that a surprise? And I know that that must be painful for the number of health people who are in the room. But in fact, no family's ever said that, not one of them. They did say they didn't want to have to worry about the debt collectors knocking on their door and moving in the middle of the night, that was unhelpful. And indeed for the Pacific families, we don't have an embedded generational dependency on welfare. across Pacific communities and families wanting to contribute and work is a strong driver. There is a fair degree of shame and embarrassment about being dependent on the state, hence our low uptake of entitlements and benefits. We understand, and as I stand here today and the World Cup's about to kick off, there is no question in my mind whoever wins the World Cup won't win it without Pacific men in the team. So whether Tonga wins, I'm fond of saying, we may not win the World Cup, but I can tell you the World Cup won't be won without a Tongan in the team. So what we know is that we can do more than play NRL, we can do more than play rugby, and we have a rightful place in New Zealand society as New Zealand citizens and members of this community in a leadership role. And we're very proud to see our young MPs, the example of young Jenny Salesa, and many more coming through, taking their role in a leadership role for the government. But of course, moving right through the community, leading our churches, our community organisations, our youth groups. This is indeed something that our communities aspire to. Well, we thought we were pretty smart, but not really. We thought we'd better ask some people who were smart. So when we developed our strategy, when we thought about our outcomes framework, we went to Harvard because they have a pretty red badge and they're pretty flash, and we thought maybe they could tell us some things. So they had a look at our outcomes framework and decided it was pretty good and gave us some good advice, and we were grateful for that, and we're grateful for their ongoing support. We've also had the Australasian Evaluation Association and the American Evaluation Association peer review our work, and that's very important to us. To really be working with the best brains in this new world of measuring outcomes and results is good for us. We aspire to excellence not only for our families but also in our work. So we have this outcomes framework, and again, there's no news to you. You'll all understand what this looks like, and it all makes perfect sense. So we have a domain of education, and we need to measure how we're performing, and it's very interesting. So a recent conversation this week with various ministers down the road where people talk about the early childhood enrolment rates, and they say, well, aren't these high, Debbie? They're already high. What are you doing? Well, in fact, they're not. It's part of the urban myth, isn't it? When you enrol your child at primary school, a nice administrator says, was Sione involved in early childhood? And you go, yes, whether or not Sione was. So the rates that, in fact, the Crown promotes as early childhood enrolment isn't actually enrolment. And so we've found some surprises as we've gone through our work and our data, and that's very helpful. Because if we don't have an honest understanding of what's going on, we can't help people to fix it. So that's just an example of some of the work. Again, being healthy. People just want to live longer and do that in a better way. So another example of the pressure not to change to a new approach. Why doesn't the commissioning agency have an indicator, say our Treasury friends, to reduce avoidable admissions at hospital? And a lot of pressure, actually, for us to put that in as an indicator. From our perspective, a lot of our children don't go to hospital early enough or often enough when they need to, and hence they die. So the indicator to stop people coming into hospital isn't mine. It might be the DHBs in the hospitals because it deals with their bottom line, but it certainly isn't about our families. So again, being clear about the evidence and the data and the approach and who you're working for is terribly important. One of the areas that we've agreed to focus on is the economic area, and that's a big surprise because people want us to do health and education, but actually, the root of all evil is money. And if we can have people in jobs, if we can engage our young people in trades and training and make sure that they can look after themselves, after their families, and after communities, that will make the biggest difference. It will change the education outcomes, it will change health outcomes, it will make the world a much better place. And so we understand that focusing quite carefully on this is important. Our last area is leadership, and I spoke about that before. The big trick is shifting minds and engaging hearts, isn't it? And I guess with this work, this meeting today, I think, is quite historic. To hear people talking about outcomes is inspirational. To have people not talk about FTEs and employing people and how many people do you employ is really helpful, because we're starting to move the focus to where it belongs. In working with our sector and with our community, we have a lack of investment in evaluation and an understanding of outcomes. Even though in most organisations, for example, when we started using computers, everyone had chief information officers, and we still do. But there's certainly no such role as a chief evaluation person or someone who's an expert. And we would challenge Crown agencies to actually start establishing this. Rather than just contracting with NGOs for outcomes, developing a real body of knowledge and expert advice in this area is really important. In the first year for us, we had to shape up our work and shape up our framework. And we're under huge pressure from the Crown to deliver. They want the answers yesterday, and our Venerable Minister was here this morning asking exactly that question. In fact, the next couple of years is just hard work, no secret about it, working with families in the best way we can to deliver the best quality support to really be able to articulate what works and what doesn't. So at this point, a year on, we have 3,000 families. This is just one example of the way that we're able to articulate our outcomes in a short period of time. So out of 472 families, 30% identified that they wanted to prioritise debt reduction, and they reduced their debt loading by 5% or more. That's a lot of loaves of bread and a lot of bottles of milk. So I really wish you well in the work that you're doing. We're very keen to work with NGOs to see how we can make a difference for our families. As a commissioning agency, our focus is on our families. And with due respect to you all, it's not about building up other people's organisations. I know, though, that we can't make a difference without your help. So I thank you for your time. Maloa Piton.